Press,
Guys,
we
hello
also
and
known
welcome to the
to
Library TV Network. Today is
our
April
distinguished
29,
platform guests,
2025,
we also
and we
known
are
to
right here
Nigerians who are following
at the
us
Ministry
in
of
the
Information
diaspora
Corporate Tourism, and we are bringing to you
across the
live
15
as to what
political
is unfolding.
subdivisions
Keep
of this
posted and please
country,
skip it.
to various community radio stations, the internet. We'd like to welcome you to another edition of the Ministry of Information, Cultural Affairs, and Tourism regular press briefing. Today is a very special day, and we have a full house. Also, there are a lot of things that the Ministry of Information has to speak to, and so here is how we proceed. We have the distinguished Managing Director of the Liberia Civil Aviation Authority, the LCAA, the Director General of the Liberia Civil Aviation Authority, Mr. Julius D. Dennis Jr. He's here with his deputy, his President Deputy, Mr. Stephen Johnson. And they've come to talk about what he's doing. Beyond that, we have a very important team. A distinguished team of physicians and researchers from the Morehouse School of Medicine. They are led by Dr. James Adaman Salib and Mr. Matthew Waluku Jr. from the Heart Center, and also creating awareness and advancing research on prostate cancer. So they are here, and as I indicated, the Minister of Information has some very important remarks to speak, and you will have the opportunity to ask your questions. We will respond to your questions, and will excuse us while we continue with the press briefing. So I now have the distinguished honor to invite the head of the delegation, Dr. James Adamasali, to the podium.
Good morning, Liberia. Good morning, friends. I'm honored. First of all, that's my school friend, Todd Boyan. I'm honored him. I went to Carroll High with him. I've been doing this for about 20 years now, more than, and where I try to collaborate. I work in America. I try to collaborate with colleagues of mine who are interested in doing different things in global health. The Heart Foundation I started years and years ago. Those who follow me know what I do is bring my colleagues to bring their specialties to Liberia. I've been coming here. I tell people, if you don't know me, then it means you're very young. Because I'm an old man now, I've been doing this. So this is not my speech. I mean, this is not, I just meet people, ask them, hey, there's a lot of research deficiency for healthcare workers in Liberia, and you want to join me? And so I congratulate them and thank them in the presence of the press for coming with me, traveling 23 hours, coming with me to join and to collaborate with the health institutes in the country to see what benefit they can bring. I will turn it over to them unless you have any specific questions for me. Yeah. Let Matthew give an overview. Matthew Wolokai works with us. Ask Matthew Wolokai to make some remarks.
Thank you to Minister Pia, Deputy and Assistant Ministers of the Ministry of Information, Cultural Affairs, and Tourism, esteemed colleagues, fellow Liberians, and members of the press. It is honor, profound appreciation, nation pride that I stand before you today to introduce an initiative that embodies unity, service, and transformation. An initiative that intertwines healthcare, cultural diplomacy, and tourism under one shared vision for progress. Today I'm speaking on behalf of the Heart Foundation and the Biomedical Research and Tourism Service Initiative, a groundbreaking collaboration among John F. Kennedy Memorial Hospital, Morehouse School of Medicine, and the A.M. Wright College of Medicine at the University of Liberia, under the esteemed leadership of Dr. Stanley and myself, Mr. Matthew Woodcock Jr. This initiative brings together respected doctors, researchers, and healthcare professionals deeply committed to advancing prostate cancer research in Liberia and also West Africa. Our efforts will focus on understanding the incidence, prevention, pathophysiology, and treatment of prostate cancer, contributing to the critical discoveries and improved health outcomes for our people. This also includes mentorship and advanced training in biomedical research. In addition to this research component, this initiative aims to enhance clinical and surgical care in the following ways, such as expanding urological surgical services, providing mentorship and specialized training, and at its core, we will launch a service learning program that provides opportunities for students, faculty, and staff from the diaspora to come back and engage with Liberia firsthand. We'll offer cultural immersive hands-on service learning experience and also deliver in-country training to empower Liberia's future medical professionals with the tools needed to deliver high-quality and patient-centered care. But this initiative is about more than just healthcare. It's about building sustainable long-term partnerships between Liberia and American institutions through collaboration in research, clinical services, public health, academic development. We are laying a foundation for a future rooted in cooperation and mutual respect. Honorable ministers, we look forward to working hand in hand with your ministries to fully realize the impact of this initiative. Together we can build a healthcare ecosystem that is innovative, inclusive, and globally respected. And thank you so much for the opportunity. Now I have the honor of inviting Dr. Leanne Verna from Morehouse School of Medicine and her team, followed by closing remarks, Dr. John McGill. Thank you.
Good morning, Liberia. Thank you to Minister Pia for allowing us this opportunity to speak today. I am Dr. Leanne Verna from Morehouse School of Medicine in Atlanta, Georgia. In the United States, I am a key expert on a national level in addressing prostate cancer in men of West African ancestry specifically, so covering the diaspora. I have been influential in changing screening guideline recommendations to better benefit Black men in the United States, because in our nation, what we see is that Black men are more likely to get prostate cancer earlier in life and to have more aggressive disease for a variety of reasons. And so I and my team are very passionate about making changes so that that does not continue to occur. My lab at Morehouse School of Medicine is funded by the Department of Defense in the U.S. Zero prostate cancer is very involved in what we do. We're also funded by Prostate Cancer Foundation and also the National Institutes of Health. Specifically in the lab, we're interested in discovering what happens at the genetic and the molecular level in tumors of Black men and men of West African ancestry that make the disease become more aggressive. And if we can find treatments that target those reasons, then we can better survival outcomes for Black men. We're also very involved in community outreach, and we're looking forward to partnering with different stakeholders here in Liberia to see how we can improve education and screening here in the country of Liberia as we are working working on in the U.S. We were very excited to meet with urology and other physicians at JFK Hospital yesterday to see how we can further biomedical research opportunities between Morehouse School of Medicine, between JFK Hospital. We will also be at Dogliati today to interact with the students and see what sort of learning and teaching opportunities that we can work together. We're excited to learn from you. Thank you for having us, and I'm excited to introduce my team members to you. I'll begin with Dr. Abdul Rahman.
Good afternoon, everyone. My name is Abdul Rahman. I am originally from Saudi Arabia. I went to Clark Athana University, the historical Black College and University, Clark Athana University, where I received my Bachelor of Science, my PhD from there. My PhD thesis was focusing on prostate cancer. And prostate cancer is the second leading cause of death in the US and disproportionately African American. Because of the need of that research, I decided to join Verna Lab, where their focus is only for fighting prostate cancer, and particularly in the population of the African American community. As a Saudi, I was raised to the core belief that people are equal, regardless of the race, background, and nationality. We do not tolerate any type of racism in any form. And we believe deeply in humanity, dignity, and mutual respect. These values are part of who I am, and they are everything that I do. That's why I am deeply honored to be in Liberia today as part of the important biomedical research mission. I believe there is nothing impossible. I believe in giving. I believe in service and in spreading education wherever I go. My mission in this life is to serve the humanity, sharing knowledge and uplift the community through the science and compassion. I am incredibly grateful for the warm welcome I have received. And I'm here not just as a scientist, but as a partner of your progress. And I truly believe that together we can build a healthier, brighter future for Liberia and beyond. And now I'm going to hand that to Mr. Eddie Stanley.
Good afternoon. My name is Eddie Stanley. I am the operation manager as well as the biospecimen manager for Morehouse School of Medicine under the research department. My background is really just cardiac medicine and emergency medicine. I have a past background as well as a flight medic and a medical assistant. Now, where I come into play here is that I am the one that makes sure that both of these wonderful people here get everything that they need. My responsibility is to make sure that all the supplies are conducted there. I train some of the trainers that come into work with us. I make sure that we're where we need to be at all times. But since I have been here in Liberia, I have observed, when we went to the hospital the other day, the heart-reaching care that the people there are doing. I'm so moved by their inspirational values that they have and what they move to get their things done every single day. And there's no doubt in my mind, no doubt, that the people of Liberia want to be healthier. They want to take care of everything. They want to get things done for themselves. And we will do as much as possible to make sure those things happen. There is no way that me as a person can allow something to continue. I am here to be of service. I'm here to be of service to humanity, and I'm just so grateful to be here with amongst you today.
Thank you so much. And with that, I have the honor of introducing our collaborator, one of the top urologists in the United States. He was Zero's Health Equity Champion of the Year last year, Dr. John McGill.